Thank you for having me.
Leah, the Mind Forum is coming up in Sydney in May, and the Mind Foundation does some great work. Your presentation is called, it's a mouthful,
It is.
Maternal Imprint, Shaping Health, Brain Development and Humanity's Future. Wow. Can you give us a bit of an overview of what people at that conference could expect to learn from that?
Of course. So Mind Foundation is such an incredible organisation, and you and I both have given a lot of time to it because we see the value in it.
Yep.
And when Leslie approached me and said, come and do a presentation, one of my great passions is about the capacity of a woman to change as she evolves into becoming a parent and the profound influence that she can have on the next generation. And so the geek in me wants to go into all the science with it. The spiritual part of me wants to look at the emotional and spiritual connection between our children and how science is catching up to what that means. But ultimately, it's about empowering the audience and empowering people in a way that the more we understand what we can do, the more it gives us capacity to realize the changes are actually essential, but also that they're meaningful rather than don't do this, don't do this, don't do this. It becomes I understand what it can do and how I can actually transform our children.
It's so interesting, isn't it? Because, traditionally we would have lived in a village, and as we grew up, we would have seen tens, if not hundreds of births and all sorts of different forms of life. And here we are, often in our 20s and 30s and even later nowadays, and we suddenly find ourselves with a young child and, oh my God, what an experience that is. So this kind of support could never be more important in 100%. Our human journey.
100%.
Yeah. A lot of statistics are showing that there are some pretty alarming childhood chronic conditions coming up. When we talk about public health, people often say, oh, well, we're getting older. That's why we're getting sicker. But actually, the kids are the canaries in the coal mine, aren't they? And they are getting sicker. Autism is one example. Yeah. How does your research on maternal influence relate to those concerning trends? What do you think's going on?
Probably the biggest is the environment. Yeah, so our environmental exposure is influencing the health of, we'll just talk about mothers for a minute, is influencing the health of our mothers and the health of their mitochondrial RNA. And we know that mitochondrial RNA only comes from the mother. There's like a handful of papers that suggest from the father as well, but hasn't been consistent. So we're going to stick with that science for the minute, which means that all of that precursor information and all of that DNA transference is predominantly managed, improved and suggested from the mother. So then what that indicates is that the health of her and her exposures are going to determine what happens. And, we've got research now that shows that the egg, the oocyte of the mother, sends the signals out to find the sperm then send a signal to meet it. She then selects the sperm itself, tidies up the sperm, tidies up the DNA that is passed over, then tidies herself up, and then enables the fertilization to occur. And if she doesn't have optimal health in that oocyte itself, then that directly correlates to the health of the child. So if she's exposed to something, then that's going to cause damage to some of that information in the oocyte, which is then going to cause subsequent challenge for the developing embryo itself. So the health of the mother is unbelievably paramount because it directly determines what information is